Hello everyone, welcome to Pigment Studio, and today we have got Miss Sunandha for the show of Pigment for the professionals. And in this opportunity, I want to give the guest the opportunity to introduce herself.
Thank you for having me actually.
Yeah.
Hi everyone, I'm Sunandha and I originally belongs to Himachal Pradesh, Dharamshala actually, and it's really beautiful place to live in. Right now I'm a registered nurse by profession and I'm posted in neurosurgery operation theatre.
Okay, so coming to your profession, actually, there are so many stigmas and all these things related to your profession,
Yes.
right? So you could start from your early career, like from the beginning of your career, like what are the struggles and all those things that you have faced?
If we talk about stigma, that the only thing which comes into my mind is like that. Oh, you are a nurse. You have to do only dressing, and you have to give the injection and medication. That's all. But I think.
So you mean to say like the profession is extremely underrated?
Yes, we could say this. Like it's extremely underrated here. But I think people should know the worth of a nurse, or not only about the nurse. It's all about the healthcare workers actually.
All right. So especially in this profession as we are nurses, so what are the struggles like on the early time? Okay, now you are settled actually with a reputed hospital and you are a registered nurse. Okay, so whether the journey was that much easy from your, as a
Not
student
at all. Not at all.
because most of the Pigment viewers are nurses actually.
Okay.
Okay, so they will be eagerly waiting to know about the experience of the nurse like that, and they will get, and some of the new nurses that they are going to get a job and all these things, they will be extremely motivated.
Yeah.
And we have international nurses also as the viewers, like, right?
I think for everyone, whether it would be a new student nurse or a new nurse who starts their journey from a hospital, there will be definitely like a orientation problem, because what should we start, from where should we start, and where we have to go, and what we have to follow. Like they have to follow all the protocols, and they don't have any idea
So
about
literally, if we are telling like internationally, there are wide opportunity for the profession.
Yes, exactly.
What about in India? Do you think like the opportunities are good in India for the profession? Like,
I think not. It's only in nursing profession. I think there are lots of opportunities. If we talk about the private hospital, or if we talk about the government hospitals, because in private definitely there will be a less salary and more work to do as compared to the government hospital, and people will deny to work that much just in a less salary actually. But in government, it would be really hard to get in, because you have to clear all the exams, and like you have to cross all the path from the exam to their
easy,
joining.
right?
Yes, it's really hard, because it will definitely need a lot of hard work.
so once you got the job and you have been posted in a particular department, so what about that as well?
Actually, when I stepped in my department, when I saw the list of instruments, I got confused. Like, how can I start that? And I was like, ma'am, like to my senior ma'am, like, ma'am, how can you learn all that things? Because it's so numerous. Like you cannot even learn that things within a month, or within 2 months or 3 months. It will definitely take a lot of time, right?
Obviously, the neurosurgery is a specialty.
Yes,
it's a
and
lot
we
of
have not only list lots of instrument as well as the sets. Okay, so in a particular set we definitely have more than 34 35 instruments, so it's quite difficult. So in early time when I was I will tell you one story. When one of my staffs, I have asked her like, ma'am, how can you remember all that things? For me it will definitely, I have to reincarnate for that. Okay, so she was like, no, you will learn by the time actually. So that was the case. So, but little by little, when I was very determined and focused towards my work, and I found out that it's quite easy when you start working on that.
Okay, so at this time I want to share one experience of my friend who have worked in OT. Like, he was really new to that setting at that time, and some of the surgeons have asked, but because he worked in general surgery,
Okay.
operation theater, and I have heard from him actually, and he was very confused about this instruments and all. And one of the surgeon have asked one instrument, okay, and he hardly knows 2 to 3 instruments on that, and he don't know exactly what the instrument that surgeon have asked, and it was really shortage of time, and the surgeon is too keen to ask the instrument. Like he have placed 5 instruments like this, 1, 2, 3, 4, and 5, and placed to the surgeon, like showed to the surgeon.
Oh.
The surgeon have picked up the instrument like that. That the critical thinking that he have done have spared him from the scolding.
I
of the
think,
surgeon,
in my
like that.
opinion, it's my suggestion to everyone, to the new nurses as well as to everyone like who is new in this field, they should learn at least about the basic instrument, so that they cannot, in future they don't have any problem. They that what is this called? What is that instrument known as? Something like that.
But in your department, if you are giving some suggestions like that, okay, to the juniors, whether they will like the suggestions or something.
I think you should have that idea how to convey your messages to the another person or to your juniors as well, because I have like a technique like if you will not learn, you will not stay here for a long time, of course. So you should be keen to learn something, and this, and I elaborate them perfectly, like, okay, this is this instrument and this is the use of this instrument, something like that. And you should, now it's after an advent of technologies and all these things, things got easier as compared to the conventional time.
So, okay, what are the advantages that you, from your experience, that you could tell, like working in ward or any other setting, rather than working in operation theater?
Like, I haven't experienced about the ward, so I cannot tell it properly, but in operation theater it would be definitely very fascinating, because I found out that you are assisting with a doctor over there, and you are a big responsibility. Of course, you have lots of responsibility in wards, in ICUs. You have to take care of patients in ICUs properly, and in OT, you don't. You have to assist with the doctors. So it would be like a little up, I would say.
Yeah.
So you need a lot of critical thinking over there in ICU as well as in operation
So critical
theater.
thinking, that means you need to have much intelligence actually working in, especially
Yes.
general surgery, not general surgery, it's neurosurgery, right? In neurosurgery operation theater, so something which is related to the brain. So
Yes.
the people who have the brain could work on this department.
It's not the case actually, because I feel like that in which department you are working, the main thing which matters is, like, you have to very confident, you have to very determined, very focused towards your work. That's really matters, in my opinion. I feel like that.
So that means you need to be very sincere.
Yes, we need to be very
and
sincere.
to be very hardworking. Like somebody,
Yes.
I think somebody could have could take actually 2 to 3 months, and someone, it's 1 month is enough for learning all the
Yes.
instruments. If you
I
are
feel
hardworking.
Yes, I feel so, because but in neurosurgery, not in neurosurgery, any super specialty department if you're working in, it will definitely take more time. Like, if we're expecting, like, oh, I will learn within a month, oh, so that's my target, it's good, but that's not possible, because you have, as I have mentioned earlier, that you have lists of like instruments, and that's
So
sets,
literally it is not possible.
not at all, because you will not get a chance
is it
to scrub over there.
Yeah, is it because you will stop to another department as well?
Yes.
So is it confined to this neurosurgery, or for any specialty it would take time, or?
Like, if you are working in super specialty, the instruments definitely will be different.
Different,
Okay, because we have micro instruments, we have also general instruments. But if you are working in oncosurgery, or like in ENT or something other departments, so the instrument likely to be, I think, same.
Right. Yeah.
Okay, but if you are working in super
So the
specialty,
general
like,
instruments will be the same. For
yes,
much of the
exactly,
departments,
yes,
right?
yes, yes, yes.
Okay, like AIIMS and all these things will be
Yes.
same, right?
Yeah,
Yeah.
but in ophthalmology it would be quite
Different.
more
Yeah,
different.
there could be more microscopic instruments
Yes,
in
exactly.
ophthalmology, right? And so how for so many cases, if we assist and we will remember the instruments like that, right? Okay, but you need to have a constant interest to learn things
Yes,
like that.
because I think you should learn the rationale of that instrument. In my,
Okay.
if as I feel like you should know why is this instrument, what is the purpose of using that instrument, and in so that you can, while you are doing surgery, meanwhile you can understand that, oh, if it's bleeding, so we can use that instrument to stop for some time.
All right.
So there should be that kind of
So that means
curiosity.
so for every surgery there would be a sequence of giving instruments and all
Yes,
these
yes,
things.
exactly.
So exactly you need to learn that sequence as well.
Sequence as well, that you should have the knowledge about, okay, what will first come, then after, okay, what, and the last thing which I feel like sometimes people are very, okay, we have to give this instrument, after that we have to give this instrument. Okay, sometimes it also depends on the surgery, because you should need to know like what are the priorities. If you need to, like for instances, if you are giving like a Surgicel is mainly used for the hemostasis in brain. Okay, so for that you
So
are
coming to the brain, so what was your experience seeing the brain at the first time like that?
I was, very like, oh my God, I was fascinated. Like, oh, it's that much beautiful. And one of my colleagues, she posted a pic of brain, not of course directly from from the surgery area, definitely from the monitor. She posted a picture of brain, and it was really very beautiful. And she, posted something like that. Oh, you should. Brain is really very beautiful, and you should also cover it through like helmet while you are driving, something like that.
I don't think that's a reason that people, if it could be the reason, like people don't want to work actually in operation theater generally, especially on this specialty, neurosurgery.
Yes, yes, yes.
I think if brain is that much beautiful, for that reason they need to come, right?
I think the main reason which I have found out that why people step back from from that
actually,
because I feel like they are really scared if they are able to learn this or not. Second thing, they are literally scared of, well, doctor will definitely scold me if I do this and that.
And what about the long standing hours?
Oh my goodness, it is like, okay, just how much days? Around 4 days ago, I was scrubbed from 2 p.m. till 8 p.m. continuously.
All right.
Without
So that is
sitting.
6 hours, right?
Continuously, and you cannot say like this, okay, oh, I need to take rest. Okay, of course, doctor will definitely, of course, they are also working with you and they will definitely cooperate you. But for the patient, you cannot do this, because if it is going already in flow and you cannot, go back in that cases.
Okay, so the long-standing hours could be a reason also that many people
Yes,
will
it
regret
could be reason, yes.
not from working from OT, right? Okay, all right. And one more thing, like unlike the ward setting, so in the OT there won't be bystanders, actually attendants. Like
Yes, exactly.
Right?
Thank God we do not need to, go to the patient's attenders, because we do not deal with them most of the times, because our work is just limited to the OT. We have to work and this and that. We cannot, the main thing is that that's why I think I love OT. That's why.
Right.
And second is my interest. I'm not good at neuro department, but neurosurgery. But yeah, after watching all these things, and now it's in my habit. I love that. Okay, neurosurgery is not that much bad actually. So that's the case.
All right. So in the working in a specialty is much stressful thing, right? So how you compete with that stress actually, like normally? So because most of the viewers, as I said, like it's nurses, so they will get motivated actually. Because most of your colleagues have when I have a conversation with them, they are telling like If it is Sunandha, it's okay. The ambience would be very different. Like,
That's why I was, laughing when you asked this question.
Yeah.
The reason I feel like you should have vibrant during your work. You shouldn't be very much pressurized on yourself. Oh yeah, how I can do this and that. No doubt, I have also fear. Like, okay, what if this will happen or this and that. But after getting so much experiences, I was like, okay, that's cool. Doesn't need any problem. So I think you should be very vibrant. You should be cool with everyone, and most thing which matters a lot is your doctors, how they are with you, how they are working with you as a team actually.
Okay.
So in my OT, I'll definitely say I never hesitate to say this thing, that my OT is really very cool. And doctors are really very, they are very hardworking, as well as they are very cool in terms of if they are say we are, when during the OT we conversate like this, sir, this happened, just we talk about only funny things, so that their stress level will go down during the OT.
All right, yeah. So because your relaxed mind is necessary to
Yes.
do something that much responsible.
Yes,
actually.
exactly.
Okay.
Of course, it also depends that I'm not saying, oh, you should laugh every time and you do this. Okay, it also depends
So
on
in a
the
controlled
situation.
manner,
Yes.
you told it is controlled manner.
Yes,
right?
it's
is
in
necessary.
it should be in control manner
Controlled
actually.
manner,
Yes, because
Okay.
it's really very necessary. And I will tell you one of my example story actually. So we have a technician over there. So OT technician, he's very good, and he's like, he never minds whenever we say something. Hey, brother, this and this. Okay, something like that. He never minds, and he's very cool also. So we have we have very good bonding with each other. So whenever he says, whenever it's time to go home, he has like 9 to 5 duty. So, sister, I have to go, वरना मेरा घोड़ा गाड़ी नहीं मिलेगा. So whenever doctor asks for him, like, where is Gaurav? So I was like, sir, वो चले गए हैं क्योंकि उनका ना घोड़ा गाड़ी नहीं मिलेगा. So like they'll definitely laugh. Oh, why sister? Why are you saying like this? So I will be like, sir, he told me like that, so I'm telling you like that.
All right, yeah. And in your Instagram post also, I have seen like you have placed one video regarding your workplace, and it's actually very funny. Like you are in between the work, okay, how you are keeping yourself very calm and funny.
Yes, actually, it is not possible with everyone, with every doctor, because some have issues with that also. But with the junior doctors, as I have mentioned, most of the doctors of our department, except our senior consultant, they are. We definitely scared of them because they are very, like that, very straight and like this. So we never.
Because
do
on
these
their
things.
perception, it may be like if we are funny also, then we will be away from the responsibility.
Yes,
like that.
exactly.
Like
And
there could be some mistake, but the real thing is, I think, like if you are relaxed, if you are focused, if you are
Yes.
relaxed, then it should be much productive than all the
Yes,
time. Right?
exactly. Because when I literally scared from, in night shift, I literally scared from, oh my God, there shouldn't be any cases. Like, okay, because in night time you have to stand all all the 12 hours, something like that.
All right.
So I just pray in night shifts, oh God, please don't give any cases over here. But as I have mentioned that it depends on the doctors actually. So whenever I got the chance with the good doctors, they will tell very good stories. Sister, this happened. So we are laughing continuously for 3 to 4 hours on that topic actually. And how the surgery gone, I don't remember on that time. Oh, that's very good surgery, doctor. You just made me relax to do this because I really scared from having cases on night shift actually.
So what's the reason, like on the night shift, if the workers is like?
Because in night shift it's already very exhausting, and I know we are there for work. I'm not scared of work actually, but the thing is that it'll be, in morning or evening, I know that there will be someone who can change the shift. There will be some reliever for me. But in night shift, there will be no reliever, and only you are the person you have to stand over there in front of doctors, and you have to assist whole night. Throughout the night, you cannot go here and there.
And I think that dark room effect also could be a worry,
Yes,
right?
you will be.
You are working with the microscopic instruments. And
Yes, it will definitely affect your eyes, and
So could you explain that dark room effect? How it would be like?
like what happens specifically if I talk about the microscope. There is a very more light, like it's very luminous, and here is dark.
No.
So you
the
have
whole room would be dark.
not that much. There definitely peripheral lights will be there.
They are.
Okay, so here you have to give the instrument to the doctor. Here you have the instruments. Okay,
All right.
from there to there. Okay, where's the instrument? Where's the
So it will
instrument?
be like two worlds. Like this is a dark world and this
Yes, exactly.
All right.
It
so
is the
on
case
one
in-
side, it is too much illuminated.
Yes.
And on the other side, it would be a dark
portion, yes. So
Right.
because
And on the
we-
dark portion, actually, I think the instrument will be placed on the tray. Right?
Yes,
Right?
exactly. Because definitely our eyes, pupil needs to contract and relax according to the light, right?
Yeah.
Because if there is very luminous, our pupil will contract, and if there is dark, or pupil will dilated.
Okay. So,
So
at the same time, means on
it
fraction
will
of
be-
a second, sometimes it would happen when you pass on one instrument to the surgeon like that.
Yes, it would. Sometimes why doctors are like, why are you not able to search those? Sir, how can I find? Because it's very difficult for me to go here and there, like something like that.
So if it is
Okay.
the constant light, then it would be much more easy.
Yes, it
So this
is.
is the challenging part, I think, right?
More challenging, and also it is very challenging to our doctors as well, because I feel like working continuously and watching through the microscope continuously to the brain, it's very, very difficult, and because it will definitely give them a pain.
All right.
And redness in their eyes. I have seen I have seen so many of my doctors. They will
So
definitely
literally, their eyes would be very on a red
red actually.
appearance,
Yes,
right? Just a constant strain.
yes.
right?
One day, what happened that
So whether on a week, so how many surgeries that you need to assist them?
nowadays it is going very hectic. At least 2 in a day, 2 surgeries in a day.
So
Actually,
literally
yes.
in a week it would be 14, right?
Rest. Most probably we don't have surgeries on Saturday and Sunday, but
If there is any emergency cases, then
yeah, then we have to assist
right,
over
yeah,
there. So yeah, that is the case.
Okay, so coming to your previous experience, like as you have worked in an NGO.
Yes.
So how was it like?
It was very, very fantastic experience I have ever had, because I feel like that working with people and directly you are communicating with people over
So
there.
what was your position at that day?
Over there, I was a nursing mentor supervisor, in which I have to, teach the staffs as well, the nursing staff, and as well as I have to, teach them the technique as well as how to do the delivery, and it is actually kind of related to maternal and child health care.
All right.
So it was a very good experience of mine, and I have learned so many things theoretically as well as practically, because I had to teach the people who are more than 30 years of experiences.
All right.
So that was really very, fun to do this.
Okay. So the people will like you, like for this actually, right?
Yeah, actually, it is very yes, it is kind of that, but at the same time, it was also
And
challenging.
some of with the conversation of some of them, they have told like your photo will be on the newspaper.
Yes, I got featured actually on newspaper of that particular district because of my work. One day what happened, I visited so many, I have to visit actually so many PHC or CHC, community health centers, as well as not tertiary, like the district hospitals.
Okay.
So I was visiting one of those, and one medical officer saw me on that time, and he was like, I have seen you somewhere. So I was like, yes sir, you might have seen me, because I used to visit here and there just because of my work. So he was like, no, I have seen you somewhere, but not in hospitals. So after some time he told me like, I have seen you on newspaper actually. So I got, I was very happy.
And what was your feeling? Yeah,
I was really very happy, and like, okay, I got some, what to say, that yeah, I got featured just because of that. People are, knowing me that, oh, you're working over there as a nurse in particular NGO.
Okay.
So that was a very good experience, and people really appreciated my work over there.
All right, so coming back to your neurosurgery, all right, so is there any other thing like, any other struggles that you need to face over there? Like,
Yes, there are actually a lot of struggles, because I feel like it's a life, and it is already, life is about struggle mostly, and wherever you are working, people have to deal with a lot of those kinds of people which you never like, actually, which cannot catch your vibe, and you cannot connect yourself with them.
Right.
So I have like those kinds of issues. Although I'm a very vibrant person, I never quarrel with anyone, and I'm just chill, and I just love to
yeah, you're obviously a very
communicate.
friendly person.
Yes.
And sometimes friendly persons could be, judged otherwise as well, right?
Yeah, I have,
Because
yes.
if we are friendly so especially on the opposite gender, they will obviously.
Yes, that they will definitely get me wrong in that that perspective, because
Yeah.
I feel
Because
like
in
that.
this profession there was higher chances just because
Yes.
there could be prejudice and all these things, because people don't usually find it like people are friendly with each other in this country.
Like here, I have like experience like that, because as an extrovert, it is like I'm very friendly to everyone. Like, oh, hello, hi. If I'll ask about their health, or how are you doing, this and that, they will be like, oh, she might be interesting in me. So no, I'm not at all interested in you. I'm just asking as a human being. So
it
that's
happens, right?
Yes,
Okay,
it
there is
definitely
definitely
happens.
a chance. So that's why most of the professionals who are ladies, they are very much introvert actually.
Yes, I have found
it could
out
be
that.
a reason, right?
Yes. So after getting those experiences, I just limited myself. Like I have to talk very less with those people and relate it to work only.
Or it's up to the people, like
Yes, exactly. If I feel like that, okay, he's not that type of stereotype of person, so I'll be comfortable with that person.
All right,
actually.
and as neurosurgery is a specialty, and you have assisted, how many cases you could possibly on around assist in neurosurgery? Like, is it 500 or 1,000 or more than 1,000?
More than 1,000 actually.
Yeah. So, in your experience, like now there are artificial intelligence, robotic
Yes,
surgery, and all
yes.
these things. So, whether it could affect the specialty in any manner, like the role of nurses in the future, is it should be taken by the robots? It's like that, anything?
I think I have,
On your experience, like you have assisted this case, is it practically possible to, especially on the brain surgery?
Yes, I have, I will, when I was new in that department, on that time, there was a new technology of an AI. So I was like, what is happening over there? So I have seen and I have experienced that AI we cannot, work through AI for a long time actually. Because
So what's the
nurses'
reason?
responsibility will be the same. I feel, because robot cannot, prepare the trolley, do this and that, and in that cases we have also assist.
No,
we
on
have-
intra-surgery, I'm asking like onto the surgery, during the surgery time, if the robot is doing the surgery, but is it that much feasible like we are doing on the human hand, and human intelligence could be replaced at that place?
For that actually, doctors are more responsible person who have good hands-on practice on that. Because I haven't that much good experiences, but I have seen only once in my life. Because I couldn't find it very feasible actually. Oh, we have to do also.
Because the risks are very much higher, like there are arteries going, and because at one time, if some damage to the brain
Yes,
it is
exactly.
irreversible, right?
Irreversible, and brain is very delicate. You cannot play with that. You can and
We cannot trust robots actually with that,
yes,
right?
actually, in good words, we can say we cannot trust robots.
So-
Okay, so it will not possible, definitely. So
Okay, so for some habituated work like setting something, cleaning or something like that, we could use the robots, but
Yes,
not
exactly.
exactly
Yes.
on the scene. Like
In the-
on the background part, we could use it. the
Yes,
robots and all
yes,
for
exactly.
sterilization purpose,
Yes.
all these things, then there would be, it could be replaced, but not on the actual scene. We need to do that, right?
Yes,
Yeah.
that what I can,
From your
agree
experience.
with you. So yeah, that was the thing which I have experienced actually. Yeah.
Okay, so other than this profession, what are your hobbies? Like you see, like because when the video was about to start, you have placed some steps and something like that, right?
Actually, I'm a very jolly person, and I have lists of hobbies actually. Like I love to play cricket, badminton.
Yeah, obviously you were the captain of cricket team over there, right?
Yes, I was.
For the
And
event.
it was I wouldn't say that it was a very bad experience, but yes, it was quite okay experience for me, because I have played cricket since my childhood to the higher schools. After that I haven't played. So
So,
playing,
and you
having
have-
a little like having
Gap,
a very big
yeah.
gap, it will be definitely difficult for you, because you haven't time to practice with along with the duties. So yeah, so that was the case, but I have to learn so many things, and one of my friends, he told me that he will definitely teach me about the cricket, and he was very good in that.
Okay.
So he told me, oh, I have played to the state or district levels, so you can ask me if you need any help. So
All right, like that. And what else?
badminton, and I was very good in volleyball. Right now I will not say this. And what else? Dancing. I'm a bathroom singer, of course. And yeah, also in acting. So I would say that I have participated in extracurricular activities in wherever I can fit myself.
Okay.
Like whether it's about the acting,
And
dancing,
you were about
singing.
to gain the black this belt in the
Yes, martial arts.
Yeah, right.
Yes, right now I have,
Is it the style is Kyokushin or this? Is it karate? There will be another style like Kyokushin, or is it the Thailand Taekwondo?
it's not, it's actually,
Or is it
it's,
mixed?
no, it's not mixed actually. It's particular karate, and it's actually mainly it is kickboxing.
Okay.
So yeah, I have learned, but I have, discontinued for a time being actually.
All right.
So after that, I'll definitely restart my those, because it's
All right.
one of
so
my
your
favorites.
friends may be scared because of you have this much.
Not at not at all,
Because they,
but
they, will-
yeah.
they need to think like, oh no, because as you are friendly on the one side, and also you are you are someone's trained actually with all these things. So if your friend knows all these things, then they would be a little bit scared, like whether I could I could.
I don't know what they will think or what they are thinking about, why by watching my this side, but I know that I am capable of doing that self defense actually. So I'm a person who never quarrel with everyone, and might be they have thinking, oh, what if I'll have fight with her? She will definitely beat me up till the till her energy goes. Like, so I don't think. Let's see.
All right. Yeah. Okay. So that's the show, and I think the viewers have liked you on your funny character and all these things, and your.
Actually, I have to be mature over here, so like, okay, but I'm more
Okay,
funny
with other
off
topics
camera.
related to the profession and all the things, we will come again with Sunandha. Okay, and Sunandha, thank you to have you on the show.
Thank you for having me, and please do subscribe and like this channel.
Okay, so stay tuned. All right. Okay.
Bye.